Our next SIR Gold Medal honoree is Dr. Michael C. Brunner. Dr. Brunner has held leadership roles in medical practice, professional societies, and biotechnology. He is a former president of SIR, board chair of the Society of Interventional Oncology, and chair of the AMA HOD Radiology Section Council. Dr. Brunner's clinical career includes private practice and academics at community, state, and federal institutions. One of his major roles was as clinical professor of interventional radiology and department head at Middleton Memorial VA Hospital, where he led a 60-person department with a $5 million budget while overseeing a portfolio of federal and industry-funded research grants. Dr. Brunner received his medical degree at Stanford University, then trained in diagnostic and interventional radiology at Emory University, general surgery at Northwestern, and vascular surgery at Stanford. Dr. Brunner's professional accomplishments speak for themselves, but the words of his SIR colleagues tell an even more compelling story.
There's no more deserving person to earn SIR's gold medal than Dr. Michael Brunner. Dr. Brunner is a mentor's mentor. I, for one, owe much of my career to him.
What I admire mostly about Dr. Brunner's personality is his openness. He's ready to engage into new conditions and in new situations and engage with other doctors and listen.
Well, the society is obviously very complex, and it is an advancing specialty, and Dr. Brunner's input has been essential to advancing those particular policies and guidelines.
When I first met Michael, he was the division counselor for the economics division, which has since changed its name. Then he subsequently became president of SIR, and then he went back to being division counselor. And I think that kind of changing of roles is something that's very unique and very special about Michael.
I admire Mike for a lot of things. I've known him for a long time. He is very quiet and unassuming. He doesn't like to take up the space in a room, but yet you know he's there. He says things that people have to listen to because they're usually important and well-researched. His perspective on things is really well-defined and based on knowledge about the things he's talking about. So there's a lot to admire in him. Oh, and sometimes he laughs at my jokes.
It is a thrill for me to be able to introduce Dr. Brunner to generations of interventional radiologists who may not have been able to work directly with him or to know his body of work. Michael has been one of those rare people who has contributed across the board to the entirety of the field of interventional radiology. Congratulations, Michael. It is such a thrill today to be able to recognize you for all that you have done for our specialty and for our society, for our patients, for our members. You are one in a million.